Welcome, Black Hollywood Live fans. On today's Fit Club, we talk holistic health and wellness with Dr. Kshamica, MD. Stay tuned for more.
You're tuned into Black Hollywood Live, Fit Club.
All right, you guys, welcome to Fit Club. I'm your host, Fallon Mercedes. You guys can find me online at fitwithfallon.com. Shaka, where can they find you?
You can find me on Instagram, Snapchat, and Twitter at Shaka Strong.
And next to me, she might look familiar. She was my doctor on the show Fit to Fat to Fit, but she's also known as Dr. Kshamica. Thank you for joining us.
Thank you for having me.
Yes, so glad to have you.
And where can they find you online?
KMDherbs.com and KMDherbs handle.
And then what about like on Instagram and all that stuff?
KMDherbs.
Oh, same thing.
Yes,
Okay.
KMD and then herbs.
Awesome.
All right, you guys, we have a lot to talk about because the doctor is in the building, and I'm excited because she's not just a traditional doctor. Maybe I'll let you elaborate more about your background. So did you work in the hospital, and how did you get to the place you are at now?
Yes, I trained in the hospital, medical school, residency, postdoctoral fellowship. I did all that training and preventive medicine fellowship. I focused more on prevention. And what I found is when I was at the hospital, I would be in the ICU working, and I would look back on people's charts, and people would be 40, 50, 60 years old, but in their charts, I would search all the way to the root cause of their problem, and I would see it's something that could have been prevented. A behavior, something they were doing, something they were eating. So it really got me to study into prevention, preventing diseases, and then I got into more natural foods and herbs, and I traveled all around the world studying herbs, and I realized that I've been seeing more success using herbs than the traditional medicines.
Yeah.
So then
Wow.
I switched my practice focus to all natural.
Yeah, because traditional medicine typically is after the fact, right? So it's
Yes.
just like, it's harder to fix something that's already happened than it is to prevent it.
Yeah, sometimes it's like a Band-Aid just covering up the root cause,
Yeah.
or sometimes it's delivering a little more toxins than we need when we have things from the earth and Mother Nature that can really help us.
Yeah.
What I wonder too, in medical school, do they teach you? Or, because it seemed like you just said you travel the world and learn, or did they teach you at all in your schooling or residency about the natural, holistic type of things that you can do, or is it strictly like pharmaceuticals? Here's your disease, this is what you take.
It's pretty much pharmaceutical based because they know after you graduate and when you start practicing, you're working in a hospital, which is very pharmacology based, medicine based. So that's what you're trained on, the medicines, because that's what they think you'll be working with. So there's very little of any natural healing.
You can tell by the hospital food that there's probably not very much of that in school, right?
This is
Yes.
true. I'll never forget my dad had a stroke due to diabetes, and I remember the food they were delivering to the room. I'm like, no, my dad has diabetes. He shouldn't be
Yeah, they're like, no, just give him this drug to inject, it'll be fine. He can do what he wants.
Yeah, so I'm eager to learn more about everything. I mean, I know you too, so I know other things that you do, which we will discuss more on. Let's first start with our first topic. Sorry, I need some water. How gut bacteria helps make us fat and thin. Now, sorry, I kind of discussed backstage with you that in this article that I did a little research on, it shows that for thin people and for obese people, there's a difference in your gut bacteria. And, can you elaborate on that? Do obese people really have different bacteria in their gut?
100% correct. Yes, the gut environment, it's like a home in its own. And what we eat and what we put in our body is represented there in the gut. So someone who's obese tends to be obese because they're eating too much, they're overeating, they're eating food that is bad for their bodies or toxic. So their gut bacteria is affected by this. Good bacteria might not be as prevalent in their body. So you're going to have a bacterial imbalance. So it's definitely different whether you're healthy or not. Now, there could be a lean person. Just because you're lean doesn't mean you're healthy either. So you can be very lean and still have an unhealthy gut. It's about taking care of your gut, putting in good foods, and cleansing, which is the topic we're going to talk about, regularly to keep that gut healthy and keep the bacteria balanced.
Now, what's the difference between like prebiotics and probiotics, and like how do they interact with this whole gut health? Like, can you get the gut health back?
You can get the gut health back, and the gut health needs to come back really if By cleansing.
Yeah.
You have to do a proper cleanse, because if you don't, you're just adding on top of what's already there.
Yeah.
And that's not, it's like a cover up of a medicine. You want to get to the root cause, which is what we were talking about as well backstage, that there's many things you can do to clean the gut. There's many programs out there. You just have to find something that's really natural, and that's going to get to the root cause.
So do you believe in taking probiotics? Because I've had so many people, I haven't got into it, but I've had so many like Reiki healers and, you know, different people who work in the field saying you got to do your probiotics. How do you feel about that?
Probiotics are like digestive enzymes. It helps you digest the food better. If you have a medical condition and you might have something seriously wrong with you, maybe that you would need that. But if you're actually taking care of your body the way it's supposed to be, your digestion is going to be fine and it won't be necessary. It's all about getting to the natural and what your body should be doing.
Okay, that makes sense.
So.
Okay, let's talk about something that I really want to talk about, and I've talked about on the show for a while. Let's talk about, I guess, you know, poop. Because because, you know, in order to lose weight, I get clients all the time who are trying to lose weight, and when they're eating clean, when they're working out, when, you know, they seem to be doing the right things, I always ask them, how often are you going to the bathroom? Because usually that's a key indicator of why they're not losing weight, because you got to get rid of those toxins. You got to get rid of, you know, all that stuff in there. But if you're not eating properly or getting enough water, your poop might not be the way it should. And you have this lovely chart for us.
Yes,
I
the
can
chart
honestly
is
say
up there.
this is the one area of like health and fitness I really haven't explored. So
No.
this will be interesting.
All right, let's dive into it.
The
So
chart is up there. I have become known as the poop doctor.
I didn't want to say it.
Yes. So when we cleanse our bodies and when we look at our health, the first thing to look at is our poop. And I could tell a lot about you from what you're seeing yourself. So when I work with people, we look at this chart here, which is the 7 different types of poop, basically. And you might fall into one category. If you see type 1, it's like hard and it's separated by lumps. It's like pebbles. Type 2 is a little more lumpy. It looks like monkey bread, maybe. Number 3 is like a banana with cracks. It can look like corn. Number 4 is it's like a snake or a banana. Number 5 is kind of like that with blobs, like kind of like toothpaste blobs. And number 6 is a little more raggedy and a little more watery. And then 7 is liquid, complete liquid. Now, where you want to be on this chart is between 3 and 5. Ideal is
Really?
4.
Oh.
You want to be at 4 all the time. If you vary between 3, 4, and 5, that's good news. Now, most people don't, but that's where you want to be. And the reason why this chart says name your poop is because when we look at this chart, poop comes out of your body, like a baby comes out of your body. So you name your own poop. So we just characterize this.
Literally name
like
it.
literally name your own. Because when I first saw this chart, I'm like, okay, well, tell me what the name is for number 1. And she's like, name your own poop. And I'm like, no, what's the name of it? And then she's like, no, you need to name it. So I was like, okay, rabbit balls.
So she came up with rabbit balls. So she might be calling me up and saying, hey, like today it was rabbit balls.
Oh, God.
Like someone named number 4.
I don't want to see it. Your text messages. You're gonna like
Yes.
Right?
Yes. Someone named number 4 Python. So he's like, hey, I had a python come out of me this morning.
Oh my God.
Then other people get really creative and put positive words, like number 4 is gratitude. So like, oh, gratitude came out of
Because
me.
that's
like
the
that.
good one.
Yeah.
Yes,
I
you know,
like
or
that,
like
yeah.
this, and so you have to name it yourself, what it
I
is
like
for you.
that, yeah.
Some people take it a step further because one day I was eating my oatmeal in the morning, and then I look at my phone, and there's a picture of real poop,
Oh, yeah.
and I was like, that's why we name them,
Yeah,
so you
so
don't
you don't
have
have
to
to send photos. You're
Yeah,
like, I
and
don't want to see it.
Yes. So if you look
funny.
at my phone right now, my phone is literally full of shit.
Her Snapchat awful.
Is literally like that. It's not one of those cool phones. So that's my phone. But yeah. But in all sense, this is very important because you want to always be at 4.
So yeah, so what do you do? So if you're at 7, what do you do? If you're at 1, what do you do?
So 1 and 2 require more fiber and more water. So 1 is telling me you really need a lot of more water and fluids and a lot of fiber, as in greens, but not greens that you juice. Like you need the roughage, the green leaves.
Yeah.
And that will make it more fibrous. And number 2 is also you need a little more water. Number 6 and 7, now you're getting into diarrhea. So basically, either something's wrong, you have inflammation or infection.
Oh, I didn't know that.
Yeah, or when you're doing a cleanse, sometimes all the toxins are coming out, so then that's okay. We know why you're there.
Makes sense.
Yes.
7, like when you're sick, you have a stomach bug,
Yeah.
or you usually.
Or you're juicing for a long time. Yeah.
That too.
Yes, because what's essentially happening is your body's trying to get rid of all this stuff really fast, the bacteria and the toxins, and a lot of water's coming. So if you are in those levels, you want to hydrate even more with electrolytes because you're losing a lot of water and you don't want to get dehydrated. So 6 and 7 means taking a lot more fluids with electrolytes.
So what does 5 mean? Because you said 4 and 5 is good.
3 to 5 is
3
good.
to 5. Okay.
5 is pretty good. If that's where you are every once in a while, it's all right.
Okay.
4 is the ideal. It's the banana. It
Yeah.
comes out easily and smoothly. Now what happens is when you're eating right, like if you're on point, you're gonna experience 4 and you're gonna know what that feels like.
Yeah.
Which is why I'm a proponent of cleansing, because when you cleanse, your body eventually always expresses number 4. So now that you know what it feels like to be clean, when you get off your cleanse or when you're eating bad and you notice that your poop looks different, you're like, oh, like you really understand that direct relationship of what you're doing and in your toilet bowl.
Yeah. Now, what about
basically.
color? Do you examine color?
Oh, I didn't think of that.
Yes, I do. Yes, color is important too. You want it to be brown, and that means it's bile and it's healthy. It's a healthy poop is brown. If it is green, it means that you're eating a lot of vegetables and it's coming out too fast, possibly, or it could be green food coloring. If it's yellow, that's not very good. It's like your body's not absorbing fat and it's coming out in your poop. So it's like yellow and you see some
You
yellow
think you
things
want
floating.
that, right? Your body's
Yeah,
not
I was gonna
absorbing
say. Someone once told me too that if your poop floats, that means it's good poop. You're getting rid of like the bad stuff. Like you're losing weight. And if it sinks, that means that it's not good poop. That is there any truth to that?
Yes, you want your poop to sink slowly.
Oh.
Yes, that's what you're looking for.
And then, so
What if
what's
it doesn't
happening
sink
ne-
at all?
No, then it's like you have too much fat in there. But it's a fat that's
So that would
not
be yellow.
digested right. Even if it's floating, it's probably the fat inside that's causing it to float.
Okay. And so, why is it bad that you're not absorbing fat?
If you absorb fat the right way, it
Yeah.
should be brown.
Yeah. Okay.
When you're absorbing fat, which is more like a medical condition, the
Gotcha.
fat comes out and then it should be out.
Okay.
The other color for poop is red, which means if you're not
Seen that
eating
before.
beets,
Yeah. Yeah,
if you're
exactly. I was eating
beets,
beets.
it's
yeah.
okay. But otherwise, it's blood.
Yeah.
If it's black, if your poop is black, it's like a dark blood, which probably started early in your digestive system. If it's bright red, it's more towards the bottom. But that one, you really need to get checked out.
Oh yeah.
So
I
anytime
freaked out.
blood.
Yeah.
Yeah, but if the beets,
Yeah, I freaked out because I started, you come to California, you start the juicing, and I'm having
Yeah,
beet juice all the
you're like,
time, and then I was like, I'm dying. I literally, I can't feel it, but I must be bleeding internally. I just kept trying to think of what I ate during that day. And I was like, wait, I've had like 3 beet juices, so maybe that was it.
Yeah, that's
And so,
probably it.
Yeah, so it went away, so it was good.
but that was a good point, Shaka, because
Yeah.
color is important, not just the consistency. You got to look at it all.
I often get this question asked. How often should you go poop?
Okay, well, when you're healthy, 1 to 3 times per day. If you're eating 3 meals, you can go 3 times, but at least once a day minimal. Anything other than that, we have to do some work.
What's the risk in like not going for 2 days? Let's say. Say
Okay.
you're at a family's house, you don't want to use the bathroom, you hold it. You know.
Is that what you're holding? Well, I'll tell you. So when you're holding it in or you're not going for whatever reason, you have poop, which is basically bacteria, mucus, toxins, undigested food, and it's sitting in your colon, right? So it's sitting there. And what does poop smell like to you?
Not great.
It's pretty bad, right? It's like a bad smell, it's odor because it's bad stuff.
Yeah.
But now imagine that bad stuff is just sitting in your body. So the fumes are actually going through your body, through your colon, into your body. And it actually does things like it metabolizes, which is it turns into toxic substances, and it can cause weight gain and other conditions. Because you got to think of that putrid smell that you smell.
Yeah.
It's just now sitting in you for no reason.
So you should get this right away. If you have, you're constipated even for like 2 days, you want to take care of it right away.
You want to take care of it right away, but you shouldn't be constipated if you're doing everything right.
Yeah.
Okay.
Now, I know you have your own line of cleanse or cleansing. Can you tell us more about that and how it can help you be more regular?
Yes, for sure. When I first started working with herbs and foods, basically I was doing research into, Native American remedies, African, Chinese, Indian, from all over the place, and putting them together and just making it one-on-one for people I encountered. But so much success, I put it online, basically. And a cleanse, the cleanse, which we have a picture of, that's the cleanse. Basically what it's doing is it's rejuvenating you. If you want to look your best, have glowing skin, have weight loss, feel the best, feel energy, sexual stamina, libido up, everything functioning to your optimal self, you basically have to cleanse, and that is getting rid of toxins. So the cleanse I have is a 20-day program, and you take herbs throughout the day. There's a formula, there's 7 formulas, so one focuses on the blood.
Oh, okay.
The blood is a powerhouse. When you clean the blood, you have clean blood going through your organs, so it's going to help. Then we clean your heart, your liver, your lungs, adrenals, bladder. Every organ is touched, so it's cleansed. Now, when you're cleaning, we're putting in good herbs and rejuvenating. So now everything is running the way it's supposed to. And that's when you see all the changes in yourself and you get yourself to your optimal.
How long do you do it, or like do you do it for a few months and then?
So this is the thing, the cleanse is not for everybody. You have to really want to do this for yourself. And that's a really good question, because like you don't ask permission from your doctor to have a beer, right? You don't ask permission from your doctor to have cigarettes. You don't ask permission to have sex without a condom. But when it comes to herbs, people think they have to ask their doctor, can I take this herb? So why do you have to ask your doctor to live, but you're not asking your doctor to die?
Yeah.
You know, so it takes somebody that really understands this is going to work and this is good and I want to be healthy. Now, I know very well most people will not change their diet. You're going to want your sweets, your pork chops, your french fries, your soda. Most people will not change. So in that case, if you're not going to change those things, it's okay. Just do this cleanse your body once every 4 months and get a reboot.
Okay.
Because if you think about it, think about your toilet bowl. We're kind of getting back to poop stuff, but I guess that's just
Doctor
what
food.
I'm Think about your toilet bowl. If you just do not clean it, what happens?
Yeah.
It's going to be disgusting.
Yeah.
It's totally disgusting and scum, and it's sticky and it's gross.
Mine's super clean. It's always
Yeah,
there.
mine is too.
Yeah,
I'm like constantly pouring bleach down.
My poop is clear and clean. It goes straight down.
Oh, no, I'm talking about after I clean it, but...
But yeah, it's like the same thing. It's like it's getting dirty, and you just have to clean it.
Yeah.
I often use the analogy sometimes it's like a pail with mud in it. So if you have mud in a pail, it's like your colon, and you keep emptying it, right? Every time you go to the bathroom, but that mud is still in there.
Yeah, it's not.
So until you clean that pail, you're not really cleaning. So I would say once every 4 months.
Okay.
If you have a medical condition that you're going to tackle, it's something completely different, and we could customize it for you. You know.
Oh, okay.
Because there's so many people, diabetes, high cholesterol, heart disease.
Oh, so you work with you do the whole gamut.
the whole gamut.
okay,
Because if you're healthy and you want to get healthier, or you want to look better and feel better, and then there's people with conditions that are on a bag full of medicines that maybe if they got their own body healthy enough, they could limit their medicines. And we can get rid of the medicines.
Now, I would say, as a healthy person, what would be like your top 3 things you think someone should be taking herbal-wise?
Herbal-wise, I would say...
I'm taking notes.
Yeah, I know,
No, I really
right?
am. Go ahead.
You know, if you're healthy,
Yeah.
I would say... Gosh, there's so many herbs. The thing is, I would say you have to take herbs for everything, like your eyes, your skin, your heart. It would be really hard to say, and I think there's herbs that you should rotate.
Yeah.
Like for 3 months, take these herbs, and then the next 3 months, take these herbs. Because most of the nutrition, even if we're healthy, right? We're eating blueberries, we're eating organic, we're having kale.
Yeah.
In America, there's a bunch of nutrients that we just don't have access to that other countries might use in their spice cabinets.
Yeah.
But if you can get hold of these herbs that are full of nutrients, why not put them in our bodies?
Yeah.
So no matter how healthy we think we are, without herbs and plants, we're missing some stuff that could benefit us.
Yeah.
What's your favorite herb to take? Since you don't, it's hard to narrow it down. What do you
Well-
love taking the most?
Something I take every day is we have a formula called hair, skin, nails. And that's just to strengthen hair, skin, nails.
Yeah.
And there's a lot of beneficial herbs that natural biotin, natural vitamins that people normally take from like CVS or the CVS store. You can get, you can go to the store and get this, but they're man-made.
Yeah.
So I take herbs for that, and then I take MSM sulfur, which is good for joints and good for overall health and protein.
I know there's a lot of issues that I see friends, family, clients, women who have a problem being fertile. And in the Dominican culture, we have like remedies. Take this for this or that. Is there any herb that helps with fertility?
There is, and it starts first with the nutrition and the healthy diet. As you know, because on your show, on Fit to Fat to Fit, when you ate a different way, it affected your cycle, right? And that is just completely showing you in your face how what you put in
Directly affects you.
affects what you eat. There's a lot of herbs like red raspberry, good for fertility. It's good. It's safe when you're pregnant. Like that's a good one. Rooibos, it's another herb. It's good for fertility. Yeah, there's a handful of
I
them.
like
Now-
the rooibos tea. I didn't know it was good.
What
for
about the
fertility.
men? For those who, need a little help getting, their stamina up.
Yes.
Is there any herbs out there that are natural rather than running out to, the pharmacy to get, what is it?
Viagra.
Viagra. Is there anything natural that you would suggest for men who have erectile dysfunction?
Yes, there's a range of herbs that if you take regularly, most men feel like they're teenagers again, and it starts again from starting with the clean body and then putting in the herbs. There's yohimbe, tribulus, catuaba. I could list a whole bunch that might sound foreign to you, but when you get to know them and you just start taking them, and then that it's nourishing the prostate, the reproductive glands, and it makes everything work right. But at the end of the day, our body is not one isolated system. So if you want the sexual glands to work, it's not like if you take something, it's just going to focus there. We're really, we're really one interconnected piece. So you want to be completely healthy. Like if your blood is healthy and flowing well,
Then
the
that's
blood to
gonna
that
be-
area is going to flow better. So that's the overall goal. You get to a place where you're optimal, then you add in those herbs to like super it.
Yeah.
So the whole point is getting to your own like great first.
And through traveling, what was your biggest? Did you have like a big surprise or a big aha moment when you were traveling, discovering these different herbs?
I did. I think it'd be a lot of times when I went to the medical systems in the other countries, they didn't have as much technology as we have here. So a lot of the times, in order to diagnose someone, to figure out what's wrong, you really have to spend a lot of time talking to someone and understanding their symptoms, because maybe you don't have an x-ray or an ultrasound or a lab report. So it kind of trains you to really, really focus on a person and understand them as an individual to see what might be wrong with them, versus just, oh, your chart says this, so you have this, so you need this, which works sometimes,
Yeah,
but
of course.
sometimes you miss things that maybe if you knew more of the history, it'd be a different treatment plan that you would use.
You get actually a better doctor-patient sort of relationship there.
Yeah,
That's
just
interesting.
understanding, in other countries also, they're a little more open to